name is Shauna, and I am with Salts Plastic Surgery in Spa Victoria. Can everybody hear me now? Is that better? And I am practicing in the area of functional aesthetics and wellness. If at any time anybody has any questions, there's a lot of information. My slides have lots of science on them. Feel free to take a picture, and I'm happy to email you the slides too if you want to get in touch with me. That's easy to do, and you can have the information. So hormones are hormones, right? Well, no. As you can see, there are so many names. They're really complex. There's many types. Bioidentical hormones are chemically identical to what our bodies make. So estradiol, micronized progesterone, those molecules are exactly what we make. That's what our bodies identify. They're different from synthetic hormones, which are not the same molecule as our bodies make. They're chemically altered, and typically they're what big pharma patents to sell as drugs. So they are what has been shown to be related to creating inflammation in the body, side effects, and even harm. So those synthetic hormones include Premarin, which is actually made by collecting pregnant mare urine, Premarin, and they conjugate, or they add a molecule to that horse estrogen and then give it to us. So that is really tough for our bodies to know what to do with. Progestin is a synthetic progesterone, again, a different molecule. It's been altered, and there are many names for that as well. The common one that we actually see in oral contraception still today is MPH. So there is a lot of confusion with hormones and their names. So there's estrogen, there's estradiol, there's Premarin, and there's progesterone, there's progestin. So they're just slightly different in name, but they're very different in molecular content. And so it's been a really tricky road to sort out hormones for women and what's safe for us and what which each hormone does. So there's been some good progress recently, and I'll get to that in the next slide with something called the Women's Health Initiative study. So now there's actually black box warnings on birth control pills because of the progestin. And that progestin, because of the inflammation that our bodies, it causes in the body, increases our risk of blood clots, strokes, and actually breast cancer. So that's now on the medication. And yeah, we're still giving oral contraception all the time with the progestins in them. So just being aware of what's in them and being educated about some other alternatives is important. And then actually back in 1991, the FDA, they withdrew all the generic estrogens, leaving Premarin as the only one. There's a lot of money to be made with drugs and big pharma, and they're connected politically, and it's a layered effect that we end up being the ones that need to be educated and aware of what's happening there. So in 2002, the WHA trial, they stopped that trial because 16,000 women that were in that arm of the trial were taking Premarin And it was found to increase their risk of stroke, heart attacks, blood clots, breast cancer, and dementia. So what they did was they made a different Premarin at a lower strength, and it's still on the market. So bottom line, progestin does not equal progesterone, and the progestins can increase all of those risks for us. So the Women's Health Initiative study.
Excuse me.
Yes.
I'm so sorry. So both the biochemical and the other two categories, both categories are chemical produced. Like they're not, but the ones on the biochemical are exactly like our
So
hormone.
bioidentical hormones are structurally, they're made actually from their base is a cholesterol molecule. And so estradiol, progesterone, testosterone, those are identical molecularly to what our bodies make. They can be in pill or cream or tablet, and the synthetics are altered. They're typically, they have another molecule added to them that makes them different in structure
My
from
confusion was just that
what we make. Yeah.
the name was the same as in our body, so I was trying to, is that what's in our body? Are you saying there's a progesterone or a testosterone that is called testosterone but really isn't the real one?
Yes.
But it is bioidentical.
So Premarin is called estrogen, but Premarin is not estradiol, which is what we make. Progestins are sometimes called progesterone. They are not progesterone, which is what our bodies make. So it's super confusing, and even in the studies, they interchange them and clump them all together. Yeah. So, I don't know. Okay, there we go. So, the Women's Health Initiative is the study that I learned back in the day, my half an hour of menopause, how to treat menopause and what to do with hormones. And that was back in 1999, and this trial, again, grouped all of the hormones together. And the conclusion was hormones are dangerous, they cause all bad things, so don't give them to women. And since then, they've taken another look at that study and sorted out who got estradiol, who got Premarin, who got only estradiol, who got progesterone, who got progestins, and discovered, and this was published in 2017, that actually the postmenopausal women who took hormone replacement did not have an increased risk of dying, and they also showed that topical hormone replacement at low dose vaginal estrogen creams, tablets, rings, do not increase the risk of breast cancer. So as a provider, the first thing, do no harm. I don't want to give anything to anybody that's going to increase their risk of anything. That's, I want to do the opposite. So the studies are confusing. The education hasn't changed. And when you see somebody who was educated in 1999, there's very different information out now. And so it's a full-time job just to keep up on this. With your providers, helping understand, there is a lot of really good information, a lot of really well-documented findings for safety, efficacy, and it's continuing to change. So keeping up with that is a full-time job. And I don't know why. I'm on the struggle bus with my slides.
There you go.
Okay, so hormones, understanding them after breast cancer. So hormonal changes due to treatment, it's also complex. There's surgical interventions which can, like in a day, create a surgical menopause. That's sudden. Our bodies are like, what? Chemotherapy, radiation. Also, the medications that modulate and affect hormones with their effects on estrogen, testosterone, and progesterone levels. So menopause has many, probably all symptoms that you could possibly think of when we have hormone imbalance. Vaginal dryness and atrophy. The reduced estrogen, it leads to thin, dry vaginal tissues, painful intercourse, urinary incontinence, decreased libido, mood swings, fatigue, brain fog, poor sleep, night sweats, hot flashes, bone loss, muscle loss, heart palpitations, headache. Literally, there's so many things we experience with that change in hormone balance. And a lot of times, again, I don't know why this doesn't show my, okay, there we go. The current research, understanding the safety of hormone treatment after breast cancer continues to evolve. So the most recent recommendations do state that vaginal estrogen is safe, and testosterone as well. There aren't as many studies with testosterone in women, hoping for more as we continue to take a look at how important testosterone is for women as well. We have it, actually in our 20s, we have almost as much testosterone as estrogen. And so there are studies that show that low dose vaginal testosterone can also improve vaginal atrophy, sexual function, without increasing your testosterone in the system and increasing risk. So that is an area of ongoing research.
Wait.
Yes?
Go back.
Maybe. That's a challenge.
Is it on? It's not on the microphone.
So can you turn on the mic for it, or turn it? Shauna, when somebody asks the question, can you repeat it?
Sure.
For people online?
Yes.
Okay.
Is it on? Oh, it's on. Good job. Who's ever in the back? Okay, can we go back to that last slide?
Sure.
Because, okay, and I'll keep talking while you do that.
Okay.
That word contraindicated.
Yes.
I feel like I want to ask what that means, because I think that means, because I felt like that second statement that you had was saying that a systemic use, okay.
Yes.
Their conclusion was that the use of systemic hormone therapy, so that's like continual estradiol pellets.
That means, any systemic, meaning like a pill or a pellet, or
Right,
yeah.
that you're continually, could be contraindicated?
Yes.
Is that a negative word, meaning that it's not approved or not suggested?
Yes. So
Okay, so despite studies that specifically showed, so why is this saying that who is concluding that, like, if I want to take estradiol pellets, and this is not hypothetical, this is my real life experience. So why is that saying that it is contraindicated despite 25 years of studies that are saying that bad information that came? I mean, that is so much our culture. The incorrect information is what sticks.
Yep.
And so we are riding this wave of, oh, breast cancer survivors cannot take estrogen. So, but then they do all these studies, and for 25 years, the studies are like, yeah, we didn't find that. Yeah, we didn't find that. Oh no, we didn't find that.
Yes.
And so why did you include that statement if that's kind of, is that?
That's incorrect.
Okay, so
Yeah.
that's what you're modeling,
Yes.
that this is the message of our culture.
Yes.
Okay, you're not, okay,
Yeah.
you're not giving us that.
No, I'm saying that, and there are tons of studies to support the fact that
Right.
estradiol is actually protective in the breast.
Oh, and it, okay,
And
and I have to,
progesterone as well. Yeah.
So you're saying that that middle statement is
It's-
what we're getting through our culture, and it's incorrect. Hallelujah.
Yeah.
That is what you
Yep.
should be saying.
Yeah.
Because when I read
Yeah.
all these reports, the greatest thing that it did for me is it gave me the words to ask my oncologist, is this true? Is
Right.
this true? Can I do this? And he said, oh yeah, we've been having success with this and prescribing estradiol for more than 15 years.
Yes.
So yeah, this is a big movement to undo this huge untruth.
Yes.
Yeah.
Absolutely.
Okay. Thank you.
Yeah.
Thank you.
Thank you for
Yeah. Yeah.
I guess I have a couple questions.
Yes.
So, and part of my feelings about her question is, what kind of medicine did they study? I don't think everybody, like you, studied hormones, and my oncologist may not. He just thinks that they're evil. Before my diagnosis, I was getting, sorry, I'm nervous, hormone treatments. I was getting the estradiol and testosterone pellets, and then taking the progesterone orally. And so when I got introduced to my oncologist, you know, all of that got dropped. He basically blamed the treatment for the cancer diagnosis, and so I quit all that. And so, but now, so I'm on hormone blockers for 5 and maybe 10 years. And so even if I tried the pellets, is the blocker going to counteract that action? And so while I'm on the hormone blockers, I mean, I'm basically in that world. And then afterwards, that might be an option to go back to. And, you know, I mean, he blamed the hormone treatment for causing the cancer, and
Super unfortunate.
And,
And you hit the nail on the head. It's education.
Yeah.
It's being aware, and there is what happens to us as humans, I think, when we first learn something, like when I learned this back in '99, it's like, oh, that's what it is. But
Yeah.
it isn't, and we have to continue to be educated. We have to continue to take the time to understand, instead of just being like, oh, this is what I learned, this is bad. And of course, this is easy for me to blame hormones for your cancer.
yeah, yeah.
And not really understanding there's so many things that affect that. And there's a lot of studies, there's a lot of data to support the protective effect of the bioidentical hormones.
Yes.
And so with the medications that affect estrogen mainly, you know, you could still do a topical estrogen cream locally that might give you some benefit, even with being on aromatase inhibitors. The aromatase inhibitor medicine is probably, and so when that treatment is designed for you, would look at what medications are you taking,
Right.
and what can be safely given, and for your benefit for symptoms and for your well-being.
Okay.
Yeah.
Yeah, because, anyway, yeah, my tumors were the estrogen and progesterone positive.
Sensitive, yeah.
And, anyway, he blamed my hormone therapy for causing my cancer, but, I really credited them with my diagnosis. He told me at the very beginning, he said, the estrogen treatments will not cause cancer, but if cancer is present, then estrogen can feed that. And anyway, so I had fallen way behind on my mammograms, and they said, we cannot do pellets again until you get these yearly things. And so anyway, I sent him a thank you note.
Yeah.
I can talk really loud.
Yeah, okay.
I'm a teacher, so I can, so my question is, for those of us that have metastatic cancer, is that also the case? Because we're never going to be finished with our treatment, and so is estradiol something we can still consider?
Yes.
Okay.
Yeah, and getting all the providers together and communicating. Yeah, and there's data out there to support it. That's the key thing. There are studies to support that, its safety and its efficacy. Okay, so that's a perfect segue to decision being made together with people that are educated in this area, which it's getting better, but it's few and far between. But there's hope. So, what to do? There's lots to do. Yes. Topicals. There's a troche, which is actually a tablet, vaginal ring. So those can help with vaginal dryness, and they don't significantly affect the overall estrogen levels. With the topicals, so every cell has hormone receptors. When estrogen is applied topically, it stays in that tissue. And then same thing with testosterone. So that is incredibly powerful for all the things. It helps with so much of our health. Libido, improves energy. So we can safely treat with topicals. And there are a number of other beneficial supplements, and choosing supplements is also tricky. There are a million of them, and make sure that you choose a clean brand, meaning something that has been third-party tested for purity, and it's documented. A lot of these actually have the purity documentation on the bottle themselves. And
Are these actual brands?
those are brands, yes.
And what are these supplementing?
I'll get to that.
Okay.
Yeah. So, vitamin D, critical. Magnesium, I have information on all of these, like my top 5. These are great, clean, well documented, well studied There are more out there. But choosing that so vitamin D. If there was one vitamin to choose D. It is actually a big part of hormone production, bone health, immune function, cell growth and repair. So particularly in the context of cancer prevention and treatment, vitamin D helps the DNA repair. Also regulates calcium, and it's needed for the production of our sex hormones and a messenger for hormone balance. Helps with insulin sensitivity, and there are studies to show it reduces breast cancer risk. So the higher your vitamin D level was associated with a lower risk of developing breast cancer. So it works with inflammation, immune function, and there are other studies that show that it actually reduces our risk. That's only one of the cancers that it's documented to show it reduces our risk of. So, D3 plus K2. Vitamin K helps the D and calcium, that metabolism, get the calcium from in the blood into our bones and muscles. So having a supplement that has both is important. Those are your doses. We can get vitamin D from being exposed to sunlight, but we wear sunscreen, we're inside. Living in Utah, our latitude, longitude, something about Utah, like everybody I test is low. Like 99% of people are low. You can get some from foods, fatty fish, fortified dairy products. But getting enough D is critical. So, fortified. What the is that? So, this is the name of an enzyme. So, we know breast cancer is the most common form of cancer in women worldwide. There are genetic factors and a lot of other components, but this MTHFR is essential for methylation. So methylation is something our bodies do that adds a carbon and hydrogen to folic acid to make the active form called folate, which our bodies can use. Many of us have a little SNP, a little mutation in this gene that doesn't methylate properly. So we end up with folate deficiency, and what happens with that is our bodies, we end up with a type of anemia, which our bodies make bigger red blood cells, and we end up with not enough active folate. All of these things are associated with folate deficiency. It's super common. It's estimated that 40% of us have this little gene SNP. So this is what it does. It instructs methylation. The most common mutations are these two. When that enzyme isn't functioning, we have higher homocysteine, which is an inflammatory marker in the blood, and then lower levels of folate and other vitamins. So does having this gene SNP give us risk for breast cancer? Again, it's like breast cancer is the black hole. It's like there's studies that say yes, studies that say no. But from a cellular level, having this methylation process in place is incredible for our overall health. So, and it's actually quite easy to treat with methylated B vitamins. And I will get to that next. So this process of methylation is critical for our DNA to function. And I think that down the road, if you haven't heard about it, you probably will. It's becoming, there's more and more information coming out, and it's estimated that 40% of us have it, and that's likely an underestimation. You need to do a genetic test to determine it, but it's not absolutely necessary because you can assume that you have it and treat with methylated B vitamins. So those are the key Bs. B9 is methylfolate. Methylcobalamin is B12. There's cyanocobalamin that is the most common form of B12 that you'll see. The cyano is actually a cyanide attachment. So, but they say a little bit of cyanide's fine. So if you can choose a methylated B12, it's already methylated for us. Same thing with the folate. So it's the readily available form. So it's important for all of us. I take it, my husband takes it, my daughter takes it. I have everybody that I see, I tell them to take it. And because it is critical for our DNA repair, our energy metabolism, neurologic health. Interesting thing with the methylated B vitamins with sleep and having our bodies be tired but our brains being awake. And the methylated B vitamins can be life-changing for that whole process.
So do they help fragile sleep patterns?
They do, in conjunction with magnesium, which I'll get to. Yeah. Magnesium is also critical for sleep. So these are doses. There are a complex of Bs that you can get that have all of these in there, in the complexes. The first brand of that list, it's Pure TheraPro RX. They have a really great one.
Pure what?
Pure TheraPro RX. Yeah. There's also just Pure, which is Pure Encapsulations, which is blue label. But the Pure TheraPro RX is great.
May I ask, do you have an opinion from pills versus liquid?
I like them both. Yeah, so injectable Bs are the highly, they're the best absorbed. Sublingual can be next.
What does sublingual?
That means in like the drops. So if you do drops, so your mouth, that's the first part of digestion. Like that, it all starts in the mouth. So that can be a really good form for absorbability. Capsules can be just as good as the sublinguals or the drops if they are made with good purity not a bunch of fillers, not a bunch of crap that we have to sort through first with our bodies, and yeah, where they're sourced from is important too. Yeah. Omega-3 fatty acids, so fish oils. Make sure, yeah. Again, sourcing is critical. We want to make sure they don't have heavy metals in them, especially mercury, that the fatty acid contains DHA and EPA. You can get a good amount from diet with fatty fish. Omega-3s are critical for brain. 97% of the fatty acids in the brain are DHA. Cognitive protection, and is also well studied for anxiety and depression. It's well known for heart health. Again, there's just conflicting data. Oh, I read a study recently that said that it actually increases our heart risk. It's like, what are you talking about? So there are omega-3 fatty acids. There are also omega-6 fatty acids. That's what they were talking about. The omega-6 fatty acids can be inflammatory. They're in seed oils like corn oil, soybean oil, the processed oils that actually increase our risk. So we want to do things like olive oil. And the omega-3s are in like walnut oil, which you can't cook with. It denaturizes at high temperatures, but it's good on like salads and things like that. Yes?
Do you have an option for vegetarian, vegan?
Yes, so flaxseed and chia seed, yeah. You can get the sources from those, yeah, nuts and seeds, yes.
Flaxseed's way cheaper.
Yeah. Yeah, and you can do flaxseed like in your smoothies or yogurt. Yeah, and there's oils too. So magnesium, it's crucial. So it is involved in over 300, literally every cell needs magnesium. It's also brilliant for sleep. And there are many different types. And again, most of us are low. Harvard study showed that more than 75% of us are deficient, and we don't get enough through our diets. There are many different types of magnesium as well, and a great type is this magnesium L-threonate. It's the only one that actually crosses the blood-brain barrier. So it's been studied for neuroprotective effects, slows cognitive decline, improves sleep. So your dose with the L-threonate, 1 to 2,000. Do one in the morning and one before bed. Usually on the supplement labels, that's pretty good recommendations if you follow what's on the labels.
What's the natural way to get magnesium?
Food, yeah.
Which kind?
Fruits and vegetables, and I will. Yeah, and that's why a lot of us are low. Our food, and I'll get to nutrition, our food chain is so highly processed now. From farm to table, there's like the things that happen to our food, a lot of the nutrients and minerals, they don't even exist in the food anymore. So we don't get what we need from our food like 20 years ago. Yeah?
What about I hear a lot about using a magnesium spray like on the bottom of your feet. What's the difference between that magnesium that you're absorbing and what you're talking about?
So all the magnesium types usually have a spray or a drop option, and that's great too. some people don't talk, like, especially with vitamin D, usually that is made with some sort of oil carrier, either coconut oil or olive oil, and some people just, they don't love the taste or the texture. But absolutely, the liquid, just every bit as good as the capsules.
Is there, like I've heard a lot of, like, put it on the bottom of your feet, like, why is that the place to put it? And
For absorption,
okay.
yeah, so just getting what you're putting in or on into the body so it can work at the cellular level. And there are a lot of things that can affect that too. Our gut health, and the acid, so we need enough acid to absorb the things that we eat and take. And topicals on the skin, that's another great option. And putting it in a place where the skin is a little thinner and not hairy, so you can get absorption. Yeah. So again, high quality products.
How do you check that? So that's the second or third time you've talked about that. But
Yeah.
if I don't have your education, so if I'm just shopping, and how do I check that?
So in the ingredients, you'll see if it has fillers. So there's like stearates and other like words, like what is that word in this vitamin? So you want to have the pure vitamin, and then also each brand will say whether they're pure, they are tested for purity, and they'll put it's on the label.
So if it doesn't say it, then
Yeah.
that's a sign. Yeah. Okay.
And Amazon, they have some great ones on Amazon, but they also have some crap on Amazon that has a lot of really wonderful reviews. So you have to look at the ingredients and go, oh, this doesn't contain the fillers, and this has been third-party tested, and we know that it's
So
documented.
it can have other vitamins with it. You're
Right.
looking at the ingredient list, you can recognize other vitamins, like you're looking at zinc with magnesium. Okay.
Yep. And you want to make sure, and where the vitamin is sourced. So a lot of sources, like from other countries, say, contain heavy metals. And so you want to do a little bit of research on where it's sourced from, and the brands have all of that information.
Right, because there's no USDA regulation of these coming into the country.
Right.
Okay.
Yep.
Can you recommend a magnesium?
I love that same, so those brands, yep, all of those brands have great magnesiums. So the Pure TheraPro RX and Orthomolecular are great. The type of magnesium also gets tricky because there's magnesium glycinate, there's magnesium citrate, there's magnesium L-threonate. So what is connected to the magnesium is each different amino acid. So if you have constipation, magnesium citrate is great. Magnesium glycinate and bisglycinate, they're interchangeable, they're highly absorbable, they're gut neutral, and great for sleep, muscle cramping. And zinc tends to help with the magnesium absorption, and a lot of us don't get enough zinc either. So,
Is there a danger of eating too much?
you can. It takes a lot. Usually, if you are taking what's recommended on the label, you will not have too much magnesium. Antioxidants, I'm going to buzz through these. You can get these in a multiple vitamin as well. C and E. Probiotics for gut health. Also, so these two types, these species in probiotics, help with gut health, also support vaginal health with pH. And you can get probiotics from foods as well. And nutrition. Food is medicine. So the bottom line is eat real food. The less processed something is, the better. Think of it as providing fuel for your cells. So we want to eat things that are highly nutritional, like grass-fed, finished, and beef, organic. Getting enough protein is really difficult. And we should be getting about, for like at least 80 to 100 grams protein a day. That helps us build lean muscle. And our muscle mass, our skeletal muscle mass, is linked to our longevity. So we want to make sure we have plenty of protein and fiber, soluble fiber, and again, getting that from fresh fruits and vegetables or cooked to avocados, sweet potatoes, all of those more complex fibers. Hydrate with water, and then eat the colors of the rainbow, and keep it simple. The less processed things are, the better. Yeah.
How much did you say about protein? Because you said it different. You didn't
Yeah,
say
that's
grams.
in kilograms.
Right.
So, like, say for a 150-pound person, it's about 80 grams.
Okay, thank you.
Physical activity, just move. Keep it simple. And you can incorporate some of Dr. Fett's things. It doesn't have to be a complex, hour at the gym. Walking is crucial, and it's forgotten. Like, just go out for a walk. You don't have to go to a Pilates class. That's great too, but just move. And like I said before, our skeletal muscle mass is related to longevity. With strength training, again, you can just set a goal. Okay, I'm going to work up to a minute plank every night. Or get your bands while you watch TV. Something that you will do. And sleep is also critical for our health. And it's, again, a forgotten, really impactful component. So I like the 10, 3, 2, 1, and I added a 0 for me because I cannot stop hitting my snooze button. So
I love that.
10 minutes before bed, no caffeine, 3 hours, no food or alcohol. Again, getting into that parasympathetic mode where we rest, digest, procreate. And then 2 hours before bed, no more work. I know all of us are super busy. Yeah, right. But that, give your brain a chance to recover, and your body. You'll be better at your work. Then screen time, blue light is terrible for disrupting our sleep. And then make a routine. You want good sleep hygiene, not like you need to take a shower before bed, but that's good too. And you could even do hot and cold. That kind of gives us this parasympathetic, so you could do a hot shower and then a blast of cold, or like, I can't do cold, but I do like warm. So I'm working on it. Not so hot. Yeah, not so hot, yeah. But that is great to create your good sleep hygiene. And then, having your sleep space meant for sleep is critical. And then getting our brains to shut down. Magnesium is wonderful, the B vitamins, and also you can, if you want to journal, you can do box breathing. You can do more of Dr. Fett's techniques to just get ready for sleep, and it's really restorative. And mindfulness, also huge and powerful. And I think we really get hung up on it, and if we're doing it right, it's what works for you, and it is continuing to evolve. So, and there's a lot of studies with the benefits of mindfulness as well for our health. All of these different types, I think, when we're thinking about mindfulness, don't be so judgy of yourself. Whatever your thought, whatever's coming into your mind, whatever sensations, they're like, oh, that's that. Observe it, let it go. Don't say, oh, that's this is bad, this is good. It is what it is. I like the term of being the observer and not the absorber of everything that's happening. Just observe it and let it go. All of these can be helpful ways of getting into that mindfulness type of practice. There are a lot of meditations out there. There are great apps. There's tons of books and audio books. Do a little search and see what speaks to you. Like, I really like the spiritual component. I really like the science component. It's all out there, and it continues to evolve too as you continue to learn more about it and be like, oh, I want to venture into learning from a different perspective. So the bottom line is love yourself. There's a lot that we can do for ourselves. We deserve it. Take the time to do it. Treat yourself like you would treat like the most important people in your lives, and do that for you. We tend to take care of everybody else and take care of ourselves last and treat ourselves, and what we say to ourselves, like I would never say that to my daughter or my best friend or my spouse or my significant other, but we say it to ourselves. So treat yourself with love and kindness, and do the things that are going to be empowering and impactful for your health and well-being. And there's a million of them, right? But hopefully it's a lot of information. There's a lot of science. There's a lot of contradicting studies, and it's really overwhelming to try and understand. But really, keeping it simple is the best way, and sharing, continuing education. And I'm always available if you guys want to email me, for specific vitamin brands or doses or anything or slides. I'm happy to share whatever is in here.
Thank you.
Yes.